Hi everyone, I'm Dr. Grant, and today I'm answering some of the most common questions people ask about blood pressure. Let's start with the very first question. What exactly is blood pressure? People ask me all the time, Doctor, what exactly is blood pressure? Let me explain in the simplest way. Inside your chest, on the left side, sits the heart, the main power center of your entire body. Its job is to send blood everywhere, to your brain, your kidneys, your skin, your muscles. And with that blood, your body receives oxygen, nutrients, vitamins, everything your cells need to stay alive. Your heart works in two stages. Stage 1, it tightens and pulls blood in. This creates the top reading on your blood pressure report, called systolic pressure. Stage 2, it relaxes and pushes blood out toward the kidneys and the rest of the body. This makes the bottom reading, called diastolic pressure. So blood pressure simply measures how much force your heart uses to pull blood in and how much force it uses to push blood out. Now, what is the normal standard? For a healthy adult, normal BP is 120 over 80 millimeters of mercury. When does it become high? If it goes above 130 over 80, that's early high BP. If it reaches 140 over 90, that is high blood pressure. And if it reaches 160 over 100, the risk of heart attack, stroke, and kidney damage becomes much higher. Low blood pressure? Anything below 90 over 60 is considered low. So overall, blood pressure tells us how hard your heart is working. Too high or too low, both can be dangerous. Another question I get all the time is, why does blood pressure rise in so many people? There are two basic reasons. Number 1, changes inside the heart. Sometimes the heart muscle becomes thicker or harder than normal. When that happens, the heart has to use more force to pump blood, and higher force means higher pressure. Number 2, your blood vessels. As we get older, our arteries lose flexibility. They're no longer soft and stretchy. So when the heart pumps blood, the arteries can't expand to absorb the pressure, so the pressure builds up. But that's not all. There are many other reasons. High cholesterol can make the blood thicker. Unfiltered waste in the body can increase pressure. Smoking tightens the arteries almost instantly. Long-term stress and kidney problems raise blood pressure silently. So when the heart works too hard, or when the arteries become stiff, or when the blood becomes harder to move, blood pressure will rise. Now this one surprises a lot of people. Why is my blood pressure high even though I feel completely normal? This happens because high blood pressure is a silent problem. There are no pain receptors inside your arteries. So a person can have dangerous numbers for years and feel nothing. And when your pressure rises slowly over months or years, your body gets used to it. It becomes your new normal, even though it's not healthy. Meanwhile, the damage continues quietly. The heart gets thicker, the kidneys get overworked, the small vessels in the brain get weaker. Feeling fine does not mean your blood pressure is fine. After 40, you should check your BP more often. If you've ever had BP problems before, check it every week. If everything is normal, a check every 3 to 6 months is enough. Here's another very common question. Doctor, what foods raise blood pressure without us realizing it? There are many. Foods made from white flour, white bread, pastries, cookies, muffins. They turn into sugar fast, tighten the arteries, and raise pressure even though they don't taste salty. Packaged soups, sauces, and ready-to-eat meals contain huge amounts of hidden sodium and preservatives. Processed meats, sausages, deli slices, nuggets stiffen the arteries over time. Breakfast foods like cereals, flavored yogurt, pancakes, and energy drinks cause insulin spikes, and insulin directly tightens the blood vessels. And too much coffee or energy drinks can temporarily spike blood pressure. So it's not only salt, sugar, processed ingredients, and hidden sodium quietly raise your numbers. Now the most important question, what foods can actually protect you from blood pressure problems? Let me give you 2 separate lists. 5 best foods for people under 40. Oats, rich in beta-glucan, lowers cholesterol, keeps arteries soft. Berries, antioxidants repair artery damage. Leafy greens, potassium and magnesium relax blood vessels. Walnuts, plant omega-3s reduce inflammation. Olive oil, polyphenol protect vessel lining and improve circulation. 5 best foods for people over 45, salmon or sardines. Natural omega-3s relax arteries and reduce inflammation. Beets, nitrates turn into nitric oxide and open blood vessels. Garlic, Allicin widens arteries and reduces stiffness. Bananas, potassium balances sodium. Low-fat yogurt, probiotics reduce inflammation and regulate hormones. 5 important tips for people who already have high BP. Cut sodium, always read labels. Walk 20 to 30 minutes daily. Reduce refined carbs, they tighten arteries. Stay hydrated, thicker blood raises pressure. Sleep well, poor sleep increases BP next day. Your heart, kidneys, and arteries are one team. The right foods and the right habits protect them. Small steps done daily can prevent big problems later.